Hello everybody, I will discuss antiemetics. So what are antiemetics? These are drugs used to prevent or suppress vomiting. To understand the antiemetics, we should know what are the major central and visceral structures involved in emesis and the receptors mediating the emetic responses. So this is the vomiting center which is present in the medulla. If this center is stimulated, there will be vomiting. Now one important relay area is chemoreceptor trigger zone. There is presence of 5-HT3, D2, M1, H1, cannabinoid 1, mu and neurokinin 1 receptors. Another important relay area is nucleus tractus solitarius. 5-HT3, D2, neurokinin 1, M1 and H1 receptors are present in NTS. So if these relay stations, through these relay stations, vomiting center is stimulated and there is vomiting. We should know there is a blood-brain barrier which protects the brain, but this chemoreceptor trigger zone is not protected by blood-brain barrier. So even blood-borne emetics like anti-cancer drugs can cause vomiting by stimulating CTZ. These blood-borne emetics, radiotherapy and other GI irritants can cause vomiting by stimulating vagal afferents via stimulation of anterior nervous system. Motion also can induce vomiting. Ototoxic drugs like aminoglycosides also can cause vomiting by stimulating inner ear. So from the inner ear there is presence of H1 receptor and M1 receptor. There is impulse generation. That impulse can reach to the vomiting center via cerebellum. Now even sensory stimuli like pain, smell, ghastly sight, fear can cause vomiting through higher centers. Now there are 4 important sites where antiemetics act. If we use anticholinergics, antihistaminics, they will block these receptors, H1 and M1 receptors present in the inner ear as well as in the CTZ and NTS. By blocking H1 and M1 receptor in the inner ear, these drugs are highly effective in motion sickness. That is why other groups of drugs are not effective in motion sickness. Only anticholinergics and antihistaminics are effective. Other groups of drugs like 5-HT3 antagonist, D2 blockers, neurokinin 1 receptor antagonist, they block these receptors present in the CTZ and NTS. Prokinetic drugs like metoclopramide can block D2 receptor present in the GIT as well in the CTZ and NTS. They can block the D2 receptor as well as they can block 5-HT3 receptor present in the GIT. Also can stimulate 5-HT4 receptor. So this is all about the emetic responses and sites of action of various anti